Welcome to the virtual open house for the Master of Science in Nursing programs here at Roche College. My name is Dr. Terri Liberto. I am the chair in the nursing department. I have over 24 years of experience in nursing education. I've been here at Roche for the last 10 years. The Master of Science in Nursing program has a distinguished reputation for preparing qualified graduates in any setting. Expert faculty, personalized attention, and commitment to excellence are the cornerstones of the MSN programs here at Roche College. We look forward to having you join us at Roche. Roche College has 3 Master of Science in Nursing tracks for the program to start fall of 17. We have Nursing Education, Nursing Administration, and Clinical Nurse Leader track. All 3 begin with core courses, so you could be admitted, take your core courses, and then decide which track you would like to pursue. The Master of Science in Nursing Education track is exclusively online. It's 37 credits total with 140 total practicum hours. It can be full-time. You can have a full-time or a part-time option status. There are varied practicum experiences. You can decide to do something here at Roche with one of the faculty, at some other educational facility. We have done many things for our graduate practicum experiences. And the program also prepares you for the CNE certification.
Hi, my name is Dorothy Kurylo. I am one of the faculty members here at Roche College. I teach primarily in the master's program, the Master's in Administration track actually, and I have several years of administrative experience as well as experience as a clinical nurse specialist. And I also have been teaching now for 14 years and have really enjoyed being here at Roche for the last 2 years. I'll be starting into my 3rd year this fall. And I wanted to talk with you today about 2 of the nursing tracks that we are offering at Roche. I'm going to start off with one of our tracks that have been here at Roche for many years. And in fact, we have many graduates of our Roche Administration Master's program that have gone on to attain high levels of distinguished positions within the healthcare setting, and have also been several of our distinguished alumni awards as well. And they have developed programs that have really improved the care of patients in our hospitals within the southwestern Pennsylvania settings. So I'm very proud to introduce this program to you. Our Master's in Administration program is an exclusively online program. It is a total of 36 credits, and of those 36 credits, there will be 120 practicum hours, which is really key to getting your feet wet in an administrative position or certainly in an administrative role that you would perhaps want to attain when you are finished with our program. Our practicum experiences are varied. We have wonderful preceptors throughout our area, and we also have students that are from California and South Carolina, so we have multiple contacts throughout the country. The practicum experiences have been both in acute care and long-term care facilities. And the other thing that our program will do for you is that our curriculum is set up so that you are well prepared to sit for the ANCC's Nurse Executive Certification. Now I'd like to introduce to you the newest of our programs that is beginning this fall, and this is our Master's in Nursing for the Clinical Nurse Leader track. This is a wonderful program. It is 42 credits, and I will talk in more detail as to what all is involved with those credits. It also, however, is exclusively online. There are a total of 400 practicum hours included in the program, and Once again, there is full-time and part-time options available. We have varied practicum experiences. Again, as we talk about the clinical nurse leader, you'll see that our practicum experiences can be in any healthcare setting. And once again, you will be prepared, and not only prepared, but will have an opportunity prior to graduation to sit for the ANCC's Clinical Nurse Leader Certification exam. That will be offered here at La Roche, which provides our students with a discount on the amount of money that it would cost you to take the certification. So let me introduce to you a little bit of information about the Clinical Nurse Leader degree and how it came about. As you all are quite aware, we are trying very hard to increase the quality and safety of nursing care in this country. And we have found that as we're attempting to do this, although we're making some strides, the complexity of care needs and the care delivery systems have increased tremendously, and they've all been restrained by costs as well. So the care environment is becoming very fragmented as we try to move patients out of the hospital or move patients even within the hospital from perhaps an intensive care unit to an acute care unit. And many of the nurses are feeling as if they're very task-oriented and have not really been able to look at the entire patient and what the patient's needs are as we prepare them for discharge. So there has been a recognition then that we really need to have a master's prepared nurse at the point of care to help implement and ensure quality and safety. So in 2013, there was a collaborative effort between leaders in both the nursing academic settings as well as in the nursing practice setting to come together and put down on paper what competencies and what education these master's prepared nurses would need in order to be able to lead from a practice standpoint. So as the curriculum was developed for the clinical nurse leader, it was felt very strongly that the clinical nurse leader would be prepared to have nursing leadership skills, the ability to manage clinical outcomes, as well as to manage the care environment. As these experts began to formulate the CNL curriculum framework, the competencies they felt needed to come from, first of all, nursing leadership, so that they knew how to provide that practice leadership at the bedside. They also are looking at having somebody who can manage clinical outcomes and can help to improve systems and to analyze systems and data in order to make a difference in our patient outcomes. They also are responsible for the care environment. So looking at how the nurses are being educated and what the nurses need to do and how to develop the nurses, as well as making sure that the care environment is safe, both for the nursing staff as well as for the patients. So they put together the curriculum and the competencies to provide the nurse with the necessary skills and knowledge in order to have that practice leadership. What this slide is depicting for you is that great increase in the number of CNLs who have graduated from certified CNL programs as well as received their CNL certification from the ANCC. This starts in the year 2006 and goes up to the most current year. You can see the tremendous increase. There are now over 5,000 CNLs that have not only graduated from their programs, but have received CNL certification. What this slide is showing is that the CNLs are employed in many different settings. Although the majority of CNLs are found in the acute care inpatient setting, you can see by this slide that you will have and can have CNLs in outpatient settings, in home health, in physician practices, hospice. So there are many opportunities out there for this role to continue to grow throughout the entire healthcare environment. As with most healthcare trends, the CNLs have been very, very active in California with over 1,000 certified CNLs in the state. And you can see, however, from this graph that we are starting now to trend this number of CNLs to the eastern portion of the United States. CNLs are increasing rapidly in the Midwest, Illinois and Ohio, I have highlighted there for you, but also in the South, Texas, Georgia. And the CNLs now are actually beginning to rise in the state of Pennsylvania. As you see, currently we have 107, and there are beginning to be many more. The clinical nurse leader really has the education to impact many aspects of the patient care system. They can improve patient satisfaction, improve clinical outcomes, operational outcomes, as well as functional outcomes. There have been multiple published articles showing the great outcomes due to the value of the CNL in the role within that healthcare environment. This is just one of the health centers that have really embraced the clinical nurse leader role. This is the Carolinas Medical Center, which is a very large multi-system center, and they have their CNLs both inpatient as well as outpatient settings within their system. And you can see here are some of the wonderful outcomes that they have been able to link directly to the CNL. CNLs have been responsible for decreasing central line infections, deep vein thrombosis, catheter-associated UTIs, falls, nurse turnover rates as well. There has definitely been some research to show that the nurse turnover rates are lower on units that actually have CNLs in place. And they feel that some of that is due to how the CNLs lead the nurses and how the CNL helps to impact their education and their adaptation from a graduate nurse to a registered nurse. So why choose a CNL degree? Well, first of all, the skill set and knowledge that you're going to obtain in this degree is in very, very high demand out there within the healthcare system. And the other reason that you may want to or are drawn to this degree is if you want to remain practice focused. This is a great degree for those who want to stay at the point of care, but not perhaps become a nurse practitioner. This gives you a wonderful practice-focused option. A friend of mine who has been a clinical nurse leader for several years and has just recently moved to a management position wanted me to make sure to explain to you all that this is really a career building degree. She felt that this was a great building block to her current management position, but she also said that she could have applied for education positions, and it also provided her with the education that she needed to move forward with her DMP, and it also is a good building block for the PhD as well. There are multiple career options in any care setting. You can become a clinician, you can become a quality improvement clinician, you can be in risk management, care coordinations, outcomes management. There are multiple names depending on the system that you are looking for a position in, but there are multiple positions out there in which the skill set and knowledge that you get in this degree are going to prepare you very well to be a strong candidate for that position. If you're interested in more information about this degree, please feel free to go to the website that is listed here. It is the AACN's website, and there are multiple very interesting connections and links to other material on the Clinical Nurse Leader degree. For additional information for any of our programs here at La Roche, feel free to contact Danelle Ball, who is our nursing admissions counselor, and her number is listed here. She will be happy to talk with you about admission criteria, the admission process, and also give you information on the multiple tuition discounts that are available through La Roche. For additional master's nursing program information, you can go to the website that's listed here and choose to look at any one of the specific tracks, or you may want to again explore all three. So I just thank you. Dr. Liberto and I are so glad that you were interested in the La Roche programs, and we hope that this has been informational for you. And please feel free, if you have any further questions, to contact either Dr. Liberto or myself, for our information is listed here for you on this last slide. We thank you again, and we both look forward to working with you. Bye-bye.